tax us more and fund the system properly, including care, along with health, and mental health, along with physical health.
If you are elderly and you need the care, you then have to pay for it yourself. If you haven't got the money, it's quite distressing for relatives that they don't know where they stand, and it's quite distressing to ring somebody, especially now you can't travel, when they're crying because the husband is in care and the money is going to run out and they're going to be sent miles away from where they live because once the money runs out. And they've worked all their lives, paid taxes. Why can't we have that system for continued social care when you need it?
I'd like to see more integration between health and social care. And as Stephen has said, we've got to spend more money if we want a better service.
More resources and more money into the NHS. Because I don't think there is much going on at the moment with more money going in. I know they say that there's more money going in for this coronavirus pandemic, but then you've got to think of people with learning disabilities, and I don't think there's more money going in there.
We rely on a lot of foreign people who have come in from Europe and elsewhere to accept appallingly low wages. But if we give people proper qualifications and proper pay levels, then the people who are paying, whether it's the local authorities or private, cannot afford. It's bad enough as it is. So there has to be more money in the whole thing.
The more you can afford, the better the care home, but care should be available for everybody without finances.
It's often the practicalities of saying their manager had said it's cheaper to wait until someone has a major crisis than funding them at the sort of start of the problem to try and avoid it. So prevention isn't always better than the sort of crisis point, which seems a bit of a shame.
I would like to feel that there's more money spent on the people actually doing the caring than there is on people making decisions, far away. Less on management, more on the practical caring for people.
The model and the funding for for elderly care, really, because from my experience, the current process is dysfunctional, and I think it's failing old people, to be honest. Yeah.
I know so many people who have some kind of help from adult social care, but usually the assessment is not about them having a good life or a normal life. It's about them having an hour in the morning, an hour at lunchtime, and an hour in the evening. It's not about them going out to see their friends. It's not about them being able to do things that make them happy. It's about giving them very basic care needs.
What we're trying to do is we're trying to encourage communities and peer support to provide the service that should be paid for and provided by professional services.